Okay, let's unpack this. In the world of equine health, there are some topics that everyone thinks they understand, but the reality is, well, it's often far more nuanced.
Hmm.
Today, we're taking a deep dive into one of those very topics: thyroid disorders in horses.
Yeah, it's a fascinating area because unlike in some other species where thyroid conditions might seem more straightforward, true thyroid issues in horses are actually quite rare.
Right.
Yet, paradoxically, we often see low thyroid hormone levels.
Mm.
So our mission today is really to cut through that complexity, explore some surprising distinctions, maybe delve into the critical diagnostic tests, and truly understand the why behind those abnormal levels we see sometimes.
And we've got some really solid sources to guide us here, including comprehensive medical excerpts covering both hypo and hyperthyroidism in horses. So we'll be breaking down the basics, thyroid function, the signs you might actually see, how veterinarians go about pinpointing these conditions.
And importantly, what treatments work.
Exactly. What's truly effective, and maybe even more importantly, what treatments we need to be incredibly cautious about. Get ready for some real revelations, I think, because what you might think you know about equine thyroid issues could be quite different from the reality.
Definitely.
So to begin our deep dive, let's maybe get our bearings first. What exactly is the thyroid gland, and why is it so vital for a horse?
Okay. The thyroid gland is a small but really mighty player nestled right there at the base of the horse's neck. Its main job is to make thyroid hormones, specifically T4, which is thyroxine, and T3 triiodothyronine.
T4 and T3, okay.
And these hormones are just critical regulators of the body's resting metabolic rate in adult animals, essentially, how fast their internal engine is running at rest.
So they're regulating metabolism, but once they're made, they're not just floating freely in the bloodstream, are they? It's more complex than that.
That's a great point. No, they're not. Once T3 and T4 get into the bloodstream, over 99% of it is actually bound up with circulating proteins, mainly albumin.
Over 99%.
Yeah.
Wow.
Yeah. Think of this protein-bound T4 as a kind of reservoir. It ensures a steady supply of the free T4. And it's that free T4, the unbound stuff, that's able to diffuse into cells.
Ah.
That's where it's often converted to T3, which is really the biologically active form that does the work. And most of the circulating T3 is also protein-bound, with just the free T3 being the active player.
And their influence goes beyond just metabolism,
Right.
right? Especially in younger growing horses.
Oh, absolutely. Before birth, in utero and in growing foals, these thyroid hormones are absolutely necessary for proper development. We're talking bone, lungs, the nervous system.
So really foundational development.
Exactly. Their influence is incredibly far-reaching right from the very beginning.
We also hear the term goiter, sometimes that sort of visible swelling in the neck area. What exactly is that telling us?
Right, goiter, it simply refers to an increase in the thyroid gland size, typically growing to twice its normal volume or even more. It's a visible sign that something might be affecting the gland.
But not what is affecting it.
Precisely. It doesn't immediately tell us if the horse is overproducing or underproducing hormones. It just says, hey, something's going on with the thyroid here.
Okay. And what about this other form I read about, reverse T3? Where does that fit into the picture?
Reverse T3. It's another form of thyroid hormone, also formed from T4, but out in the peripheral tissues. Interestingly, its concentrations tend to decrease when the body ramps up its production of T3, the active form. It's all part of this complex regulatory balance.
So now let's turn to the situation where thyroid hormones are too low, hypothyroidism. And this is where things get really fascinating, because I think a common assumption is, well, if a horse has low thyroid hormone levels, they must be hypothyroid.
Yeah,
Simple, right?
Right. That's the logical leap people make.
But I've heard, and our sources confirm, that true primary hypothyroidism, where the thyroid gland itself is the actual problem, is actually quite rare in adult horses. So if that's the case, what else could be causing those low readings we see?
That's exactly the central misconception we really need to tackle today. You're spot on. True primary hypothyroidism in adult horses is indeed rare. And this raises that crucial question. If the thyroid gland itself isn't usually the culprit in adults, why do we so frequently see these low thyroid hormone levels?
Yeah, what's going on?
The answer most of the time lies in something called euthyroid 6 syndrome. It's also sometimes called non-thyroidal illness syndrome.
Euthyroid 6 syndrome. Okay, so this isn't about the thyroid itself being faulty. This sounds like a really crucial piece of the puzzle. Can you explain what's happening there?
It really is the key. This syndrome is the most common reason by far that adult horses have low circulating thyroid hormone levels. And critically, it's not a problem with the thyroid gland's ability to produce hormones.
Okay.
Rather, it's a physiological adaptation. Is the animal's body responding to some kind of systemic illness or injury or maybe severe stress? Their body is essentially down-regulating its metabolism to conserve energy.
So it's like the body's deliberately turning down the thermostat during a crisis.
Exactly. That's a great way to put it. Conditions like, say, chronic laminitis or PPID, pituitary pars, intermediate dysfunction, what people often call equine Cushing's,
Mm-hmm.
or metabolic syndrome, or even
Mm.
certain medications like glucocorticoids, phenylbutazone, certain antibiotics like trimethoprim sulfa. All of these can cause this drop in measured levels.
Wow.
But the key is, the thyroid axis itself, the whole system, is functionally normal in these cases. It's the body wisely responding to an outside stressor or illness.
That is a huge distinction for anyone trying to figure out what's wrong with their horse. So when we do encounter true primary hypothyroidism, which is more common in foals, right? What does that look like? What are the signs?
Yeah, in foals, it's much more recognized and often devastating. The most impactful form is congenital hypothyroidism, sometimes called dysmaturity syndrome. It's a bit of a paradox, actually.
How so?
Well, these foals can be born after a really long gestation, often over 350 days, so technically they're post-term. But despite that, they show clear signs of being underdeveloped or dysmature.
Okay, so long pregnancy, but immature foal. What kind of signs?
You might see really dramatic musculoskeletal issues. Things like severe flexural deformities, cramped tendons, or underdeveloped bones in their knees and hocks. Sometimes they aren't fully ossified, even ruptured tendons.
Oh, wow.
Sometimes they have a condition called mandibular prognathism, more commonly known as monkey jaw, where their lower jaw protrudes. They're often just very weak, have a poor suckle reflex, maybe a poor hair coat, or even neurological signs.
That sounds really serious.
It is. Unfortunately, the prognosis for future soundness in these foals is generally quite poor.
And what's causing these severe issues in the foals? Is it something preventable?
It often comes down to the mare's diet during pregnancy, specifically iodine balance. Either deficiency or, perhaps surprisingly, excess iodine can cause it. Excess often comes from things like kelp or seaweed supplementation.
Too much of a good thing, maybe?
Exactly. Another cause is if the mare eats goitrogenic plants during late gestation plants that interfere with thyroid function. Things like cabbage, kale, soybeans, turnips, or maybe endophyte containing fescue grass.
Fescue, right. That comes up a lot. Now, shifting back to adults, for those very rare cases where an adult horse does have true primary hypothyroidism, what might someone observe then? The signs are probably less dramatic.
Generally, yes, much less dramatic and often quite vague, which adds to the diagnostic challenge. If true primary hypothyroidism does occur in an adult, it's usually because of severe chronic inflammation of the gland thyroiditis, or very rarely, a thyroid tumor that's actually impairing its function.
And the signs?
Often things like just general lethargy, dullness, maybe decreased exercise tolerance, perhaps a tendency to gain weight. Although, interestingly, in experimental studies where horses had their thyroids removed, they sometimes showed decreased appetite and even weight loss. So that complicates the picture.
Yeah, that is confusing.
Other signs can be a poor hair coat, maybe delayed shedding in the spring, cold intolerance, and sometimes local or generalized edema, like swelling. Less common signs might be being consistently cold, hypothermia, or having a slow heart rate, bradycardia.
Okay. And what about that classic picture people used to talk about? The overweight, crusty-necked horse with laminitis. Is that hypothyroidism?
That's another really critical point, that classic presentation, the weight gain, laminitis, the cresty neck, abnormal fat deposits that's now really recognized as manifestations of insulin dysregulation. It's part of equine metabolic syndrome, or EMS.
Right.
Now, these EMS horses may have concurrent low thyroid levels on a blood test, but it's almost always due to that euthyroid 6 syndrome we talked about, not true primary hypothyroidism. The underlying issue is the metabolic syndrome, not the thyroid itself.
So it sounds like there are just so many factors that can push those thyroid hormone numbers down on a blood test without it meaning the thyroid gland itself is failing.
Precisely. It's not just systemic illness and medications. Things like the horse's age foals naturally have higher levels than adults. Even things like very cold weather can sometimes lead to higher levels, while intense physical training can sometimes decrease levels. And diet, as we mentioned with the foal's high or low iodine, high carbohydrate diets, or that endophyte-containing fescue, can all influence these circulating hormone concentrations, even when the thyroid function is perfectly normal. It's a truly complex picture.
It really is. So given all these confounding factors and how common euthyroid sick syndrome seems to be, diagnosing true hypothyroidism in an adult horse sounds incredibly challenging. How do veterinarians manage to cut through all that noise? Is there a definitive way to sort this out?
It is challenging, absolutely, because as you said, just looking at a single low blood test result is often really misleading in adult horses.
Okay.
The diagnosis needs a much more thorough systematic approach.
Okay, so what does that involve?
Well, first, just carefully evaluating all the clinical signs and getting a really detailed history is key. And ruling out those other big players like EMS, PPID, or the effects of any medications the horse might be on.
Right, rule out the likely suspects first.
Mm.
What about the blood tests for thyroid hormones themselves? T4, T3, are they useless then?
Not useless, but they need careful interpretation. Baseline measurements of total T4 and total T3 are certainly done. But, as we've hammered home, low levels alone in adults very often just indicate euthyroid sick syndrome.
Okay.
There's a specific test, free T4 by equilibrium dialysis, or FT4ED, which is considered more reliable because it's less affected by those protein binding changes and non-thyroidal illness.
FT4ED, okay.
And in terms of other general lab findings, horses that are truly hypothyroid might show things like mild anemia, maybe a low white blood cell count, or high cholesterol. But again, those aren't specific or definitive on their own.
So how do you get past that euthyroid sick noise then? How do you confirm if the thyroid gland itself is actually failing? What's that definitive test you mentioned earlier?
This is where the gold standard for assessing thyroid function in horses comes in. It's the thyrotropin-releasing hormone stimulation test, or TRH-stim test. This is the crucial one.
The TRH stimulation test. Okay, tell us how that works. It sounds like a real game changer for getting a solid diagnosis.
It really is. So for the TRH-stim test, you start by taking a baseline blood sample. Just measure the horse's initial T3 and T4 levels.
Right.
Then you administer 1 milligram of TRH intravenously. TRH is the hormone from the brain that normally tells the pituitary to tell the thyroid to work.
Okay, so you're stimulating the system.
Exactly. And then you collect blood samples again at 2 hours and 4 hours after giving the TRH.
And what are you looking for in those follow-up samples? What's the interpretation? What tells you if it's normal or not?
Okay, so in a normal, healthy horse, you expect to see those baseline T3 and T4 levels already within the normal reference range.
Yeah.
And then after the TRH injection, you should see a significant increase. Typically, T3 will roughly double at the 2-hour mark, and T4 will roughly double at the 4-hour mark.
So a strong response.
A strong response. It shows you have a functional pituitary thyroid axis. The brain signals, the pituitary responds, the thyroid responds, everything's working.
And if it is true, hypothyroidism.
Then you see a blunted response, or maybe even no response at all. The T3 and T4 levels just don't rise significantly after the TRH. That strongly suggests true primary hypothyroidism, meaning the thyroid gland itself isn't responding to the signal.
Ah, okay.
And this test is so critical because it really helps differentiate that primary thyroid gland failure from the much more common misleading euthyroid sick syndrome.
That makes perfect sense. Are there any side effects from doing that test?
Generally very minor and short-lived. Some horses might show a transient cough, maybe some muscle twitching or fasciculations, or sometimes they do that classic Fleeman response, where they curl their upper lip and lift their head.
Yeah, like they're smelling something interesting.
Exactly. But these effects are usually very brief and resolve quickly on their own.
Okay. What other diagnostic tools might vets use in working up a thyroid case?
Well, imaging can be very useful. Ultrasonography lets you look directly at the thyroid glands, assess their size, shape, and internal structure. You can identify things like cysts or tumors.
Great.
There's also scintigraphy, which uses a small amount of radioactive iodine, or technetium, to assess how well the thyroid gland is taking up iodine and functioning. It gives you functional information.
More dynamic, less just structural.
Correct. And sometimes a thyroid tumor or a large goiter might even show up on an X-ray as just increased soft tissue density in the throat latch area. And in some cases, a vet might do a fine needle aspirate or even a biopsy to get cells directly from the gland, although the glands are quite vascular, so biopsy carries a bit more risk.
And finally, when you're considering a diagnosis of hypothyroidism, what other conditions absolutely have to be on the list to rule out first?
Yeah, the differential diagnoses. For an adult horse where you suspect hypothyroidism, the top things to rule out are usually a pituitary tumor causing PPID or insulin resistance as part of equine metabolic syndrome, because, again, those horses so often have euthyroid sick syndrome, making their thyroid levels look low.
Makes sense.
For those foals with congenital hypothyroidism, the differentials would include things like fescue toxicosis from the mare's grazing, simple prematurity, maybe angular limb deformities from other causes, or even systemic infection like sepsis. It's always about ruling out the more common or more likely conditions first.
Okay, so let's say you've done the diagnostics, you've run the TRH stim test, and you've confirmed true primary hypothyroidism. What does treatment typically involve then?
Right, so for foals with congenital hypothyroidism, the prognosis is often guarded, as we said. Treatment is mainly supportive things like splinting for those orthopedic deformities,
Yeah.
maybe assisted feeding if they're too weak to suckle properly. Thyroid hormone supplementation, T4, might also be used. But the underlying developmental issues can be hard to overcome.
Okay, and for adults?
For adult horses where you've confirmed true primary hypothyroidism, and that confirmation is key, then replacement therapy with synthetic levothyroxine, which is T4, is the drug of choice.
Levothyroxine, okay.
A common starting dose is around 20 micrograms per kilogram of body weight, given once daily. That usually maintains both T4 and T3 levels in the normal range for about 24 hours. So for like a 1,000-pound horse, that's about 10 milligrams per day.
And is that usually lifelong?
Yes, typically it's a lifelong treatment. And it requires regular monitoring, checking serum T4 and T3 levels, maybe every 30 to 60 days initially, to make sure the dose is right and adjusted if needed.
So if a horse genuinely has primary hypothyroidism, the prognosis with supplementation is generally pretty good.
Yes, generally. Adult horses with true confirmed primary hypothyroidism typically respond very well to the T4 supplementation. They feel better, their signs resolve. However, this leads us to probably the most crucial point of this entire deep dive, a really, really important takeaway message.
Okay.
It is absolutely critical not to treat horses with thyroid hormone supplementation if they just have euthyroid 6 syndrome, or if the diagnosis of true primary hypothyroidism hasn't been definitively established with that provocative TRH test we talked about.
Right. Why is that such a strong warning? What are the actual risks of giving thyroid hormone when it's not truly needed?
The risks are significant, and this is something we really need to emphasize. Giving exogenous thyroid hormones, supplementing T4, to horses that are actually euthyroid sick can potentially cause further deterioration of their overall condition. Remember, their body is already trying to conserve energy because of illness or stress.
Right, you're overriding that protective mechanism.
Exactly. You're artificially speeding up their metabolism when their body doesn't want to. It can also cause downregulation, basically suppression, and potentially even atrophy or shrinking of their own thyroid gland over time, possibly making them truly hypothyroid when they weren't before.
Wow, okay.
And even more concerning, there are recent studies suggesting that this practice, especially if not monitored closely or if the dose is too high, can lead to adverse cardiac effects. Things like an increased resting heart rate and even potentially serious arrhythmias like atrial fibrillation and irregular rapid heartbeat.
That's serious.
Very serious. And this is particularly relevant when we see thyroid hormone being given, sometimes off-label, for conditions like equine metabolic syndrome or recurrent laminitis, where the goal might be, to try and boost metabolism or improve insulin sensitivity, rather than treating a confirmed thyroid deficiency.
So just to be absolutely crystal clear for everyone listening, it's not just, oh, the T4 is low on the blood test, let's give some T4. It absolutely has to be low T4. Okay, let's investigate why. Let's do the TRH stimulation test.
Yes.
And only if that test confirms primary hypothyroidism, then we consider T4 supplementation.
That's precisely it.
Yeah.
Nail down the diagnosis first, always. Rushing into supplementation without that definitive confirmation can genuinely do more harm than good. It's a really important principle. And just a couple of other points on management. If supplementation does need to be stopped for some reason, it should usually be tapered off gradually over several weeks, not stopped abruptly. And thinking about prevention for the foals, it's vital to carefully examine the diet of pregnant mares, ensuring proper iodine intake, not too little, not too much, and avoiding that endophyte-infected fescue hay, especially late in gestation.
Right.
If fescue grazing can't be avoided, using a medication like domperidone daily can help counter its negative effects on hormones like prolactin. And finally, if a tumor is the cause of abnormal thyroid levels, then surgical removal of the affected thyroid lobe should be curative.
Okay, that covers the low side pretty thoroughly. We've spent a lot of time on too little thyroid hormone. What about the opposite end of the spectrum, too much hormone or hyperthyroidism? Is that as rare as true hypothyroidism seems to be in horses?
Even rarer, actually. True, naturally occurring hyperthyroidism, where the horse's own thyroid gland is just overproducing hormones, is extremely rare in adult horses. Unlike in some other species, like cats, where it's quite common, it's a real rarity in equines.
Extremely rare. So if it's that uncommon naturally, where do we typically see horses presenting with signs that look like hyperthyroidism? Is it often caused by something external, maybe?
You're hitting on the key point again. The most common form of hyperthyroidism that we actually encounter in horses is iatrogenic hyperthyroidism.
Iatrogenic meaning caused by medical treatment or intervention.
Exactly. It happens when horses are oversupplemented with exogenous thyroid hormone, like the levothyroxine we just discussed, often given, again, for suspected hypothyroidism that wasn't confirmed, or sometimes even used inappropriately in an attempt to cause weight loss or manage insulin resistance without a confirmed deficiency.
So if I'm understanding this correctly, most cases of hyperthyroidism, the signs of an overactive thyroid in horses, are actually caused by, well, by us, by owners or maybe even vets inadvertently giving too much thyroid hormone?
That's often the case, yes.
Yeah.
It's a classic example of too much of a good thing or maybe too much of something that wasn't actually needed in the first place.
It's a sobering reminder, isn't it, that even with the best intentions, interventions can have unintended consequences, especially in these complex hormonal systems. But what if it is one of those extremely rare, true, natural cases? What's the underlying cause then?
In those very rare instances, the most common natural cause of true hyperthyroidism in horses is a functional thyroid tumor, usually a benign one called an adenoma, or extremely rarely a malignant one, an adenocarcinoma, that is actively overproducing hormone.
Okay.
But it's really important to note that most thyroid tumors we find in horses are actually benign adenomas that are non-functional. They just present as a lump or a palpable mass in the neck, but they don't cause hyperthyroidism.
So finding a lump doesn't automatically mean hyperthyroidism.
Not at all. Theoretically, very, very high dietary iodine intake could also potentially induce hyperthyroidism, but again, that seems to be quite rare in practice.
Okay. So for that rare horse that is truly hyperthyroid, what kind of signs would they show? What would be the telltale symptoms of this excessively accelerated metabolism?
Well, all the clinical signs really stem from that revved up metabolic rate. You'd expect to see things like weight loss, often significant weight loss, despite the horse having a normal or even a voracious appetite.
Eating a ton, but still losing weight.
Exactly. They might be hyperactive, nervous, show increased excitability. Physically, you might see tachycardia, that's an increased heart rate, or tachypnea, an increased respiratory rate, maybe increased sweating, a poor hair coat despite good nutrition. Some horses develop polyuria, meaning increased urination, and polydipsia, which is increased thirst. And sometimes you might also notice muscle tremors or just generalized weakness. And of course, a goiter and a large thyroid might also be palpable.
How is hyperthyroidism diagnosed then, especially given how rare the natural form is? Is it straightforward?
The first step is evaluating for those classic signs of hypermetabolism we just discussed, and, crucially, ruling out other common causes of weight loss in horses. Things like dental problems, parasites, chronic disease, malnutrition.
Right, rule out the simple stuff first.
Definitely. On blood work, finding elevated total T4 and free T4 levels, often 2 to 3 times higher than the upper limit of normal, would be highly suggestive. However, just like with hypo, there's a more definitive test. The gold standard for diagnosing hyperthyroidism is the T3 suppression test.
The T3 suppression test. Okay, how does that one work? It sounds kind of like the inverse of the TRH stimulation test we talked about for hypo.
It is, in a way, testing the feedback loop. You start by taking baseline T3 and T4 levels. Then you give the horse oral T3, a medication like liothyronine, for several days.
Okay, so you're giving T3 hormone.
Right. The idea is that this exogenous or external T3 should provide negative feedback to the horse's pituitary gland. In a normal horse, this flood of T3 will tell the pituitary to stop producing TSH, thyroid-stimulating hormone, which in turn should cause the horse's own thyroid gland to decrease its production of T4 and T3. So you'd see a significant drop in their levels.
Makes sense. The body realizes there's enough hormone around.
Exactly. But in a truly hyperthyroid horse, whose thyroid gland is overproducing hormones, autonomously, meaning it's just doing its own thing and isn't listening to the pituitary signals anymore.
It's gone rogue.
Pretty much. In that case, even though you're giving external T3, the horse's own T4 and T3 levels will fail to suppress normally. They'll stay high despite the T3 administration. That lack of suppression is the key diagnostic finding.
That's clever. What about imaging for hyperthyroidism? Can that help pinpoint the problem? Maybe find that rogue tumor?
Yes, imaging can be helpful. Ultrasound, as we mentioned, can identify and characterize thyroid masses, helping see if there's a tumor present. But scintigraphy, using that radioactive tracer, usually technetium 99 meters per technetate, is generally considered the most definitive way to identify a functional tumor
How does that work?
because the tracer is taken up by active thyroid tissue. So a functional tumor will light up brightly on the scan, showing exactly where the overactive tissue is. Fine needle aspiration or a biopsy might also be considered, but again with the caveat about the thyroid glands being highly vascular.
We're at risk of bleeding. And finally, what about treatment for hyperthyroidism? What are the options once it's confirmed?
Well, the treatment depends entirely on the underlying cause. If it's the most common scenario, iatrogenic hyperthyroidism from oversupplementation,
Just stop giving the supplement.
exactly. The most important step is simply to immediately stop administering the exogenous thyroid hormone. The horse's own system should take over, and their hormone levels should normalize, usually within days to maybe a few weeks.
Okay, that's straightforward. What about for the rare case of a functional thyroid tumor?
For those rare cases, surgical excision removing the affected thyroid lobe is generally considered the treatment of choice. It can be curative. However, it's a delicate surgery because the gland is so vascular and it's located near important nerves, like the recurrent laryngeal nerve that controls the airway.
So, skilled surgeon needed.
Definitely.
Right.
Other options used in other species, like long-term medical management with antithyroid drugs or radioiodine therapy to destroy the overactive tissue, are very rarely performed in horses for hyperthyroidism, mostly due to cost, logistics, and the rarity of the condition itself. Surgery is usually the go-to if it's a tumor.
Wow. Okay. That was a truly enlightening deep dive. It feels like we've really peeled back the layers on this.
Yeah.
It's clear that equine thyroid disorders are far more nuanced and, frankly, less common in their primary forms than often portrayed.
Absolutely. What's truly fascinating, I think, is how often abnormal thyroid hormone levels in horses are actually a symptom of a larger issue, like that euthyroid 6 syndrome, or are even caused by well-intentioned but ultimately unnecessary supplementation.
Yeah.
True primary hypo and hyperthyroidism are surprisingly rare creatures in the equine world, which just underscores how critical that careful step-by-step diagnosis really is. Don't jump to conclusions based on one number.
Right. And the key takeaway then for you, our listener, has to be the absolutely vital role of those specific diagnostic tests, the TRH stimulation test for suspected hypothyroidism and the T3 suppression test for suspected hyperthyroidism. These aren't just, academic exercises for vets. They are the bedrock. They're how we distinguish true thyroid disease from these physiological adaptations or from problems we might have inadvertently caused. And crucially, they help us avoid treatments that could actually be ineffective or even harmful.
It really encourages that critical thinking, doesn't it? Questioning assumptions, looking at the whole picture, considering different viewpoints. It's such a powerful reminder that in these complex biological systems, like in a horse, a simple low number or a high number on a test doesn't always tell the whole story. You need the context. You need the full picture.
Absolutely. So wrapping this up, what does this all mean for you? Given how readily available thyroid hormone supplements can be, and how, as we've discussed, they're sometimes misapplied, not just in horses, but potentially across different species. Think about this. What other common practices, maybe in veterinary medicine, maybe even in human health, might benefit from a similar kind of deep dive, a closer look at their true efficacy versus potential unintended consequences?
Especially perhaps when we're treating symptoms that might actually be secondary physiological adaptations to an underlying primary condition.
Exactly. How might really understanding that distinction, like we've explored today with the thyroid, change how we approach treatments for complex multisystemic conditions in animals and maybe even beyond? Definitely something to mull over.
It is something to think about until our next deep dive.